Okay. Hi, everyone. We are doing our presentation on psychosocial integrity, and our topic is grief and end-of-life care considerations. So to get started, our first topic is letting you guys know the difference between palliative care and hospice care, because we've seen a lot of questions on this on our EAQs and on our HESI. So basically, the main difference is that hospice care is provided to patients who have a medical prognosis of 6 months or less, and they aren't doing any curative treatments. While palliative care, they can still pursue curative treatment, and it can happen with any age at any stage of illness. Both of these, palliative care and hospice care, both of their main focus is providing comfort care and complex symptom relief. So you're just making sure that they're as comfortable as possible and as pain-free as possible. Note to remember is that hospice care does include palliative care resources, but palliative services do not include hospice care resources, mainly because hospice care is for those patients who are nearing end of life. Here's a video on just like the inside of a hospice care center. This PowerPoint, this Zoom session with the PowerPoint presentation will be on that Google form. So make sure you guys go back into it and watch this video just to see how, like what kind of care is provided to these patients and what their families and the patients are experiencing.
Okay, next is the 5 stages of grief. So the first stage is denial, and that's going to be the first reaction when a patient experiences a loss or is diagnosed with a terminal illness or anything along those lines. So they'll deny the reality of the situation, firstly, and then after denial, they'll move into anger, and that'll be once they're moving out of denial and kind of masking their feelings, they'll start to really feel the reality and the pain of the situation setting in. So they can express their anger on inanimate objects, strangers, friends and family, or they can also direct their anger towards their loved one that's actually dying or has died. After anger, you have bargaining. So that's when they start to feel helpless and they attempt to regain control. And they often do that by trying to make a deal with God or another higher power, or they will express a lot of if only statements, such as, if only I had done something sooner. After bargaining, they move into depression. So that's when you have feelings of sadness and regret, and you start to question, what is my life without this person? My life is meaningless, etc. And then after depression, you move into acceptance, which is where you can recognize and process the loss without denying it, and the person will be in a stronger place than they were before. And it's important to note that you usually will not move into the acceptance phase without first experiencing the first 4 stages before that. And then we have this video about the stages of grief that gives some funny little examples of all the 5 stages, if you would like to watch that.
So I covered religious considerations. Religious considerations are usually the things patients will request either before they die, and it's usually based on either what the patient is or the family. So certain religions have different opinions on organ donation, autopsy, and embalming. There are more notes in the speaker's notes of the PowerPoint if you want to read about that, but I'm just going to cover some of the little nuances in here. So for example, the Buddhists, they are okay with autopsy, but because they recommend the 3 to 4 days for them because they believe that the soul needs some time to actually leave the body before you're allowed to do an autopsy. Catholic and Christian are usually okay with all of them. And by the way, embalming is whenever they preserve the body, and usually that's done for burials. In Hindu culture, a lot of the things are personal choice. The only thing that they're not okay with is embalming, and that's because usually they cremate the body within 24 hours. It's the idea that they want to be reincarnated quickly, so they usually don't bury their dead. In the Islam faith, there is debate on organ donation. Most will say that it's okay to donate their organs if it saves a life, but apart from that, they believe it's a desecration of the body, and because they don't like whenever the body is moved. For them, anytime you move the body from where it's died, they believe that it's a desecration of the body. So they also don't do autopsy or embalming. Jewish faith tends to be divided on organ donation, but most of the religions agree that it's okay if it saves another person's life, but they are also against autopsy and embalming. That's very similar to the Islam faith, where they want the body to return to the earth quickly. So they will usually refuse autopsy, and they usually refuse embalming.
Next, we have cultural considerations for death and mourning. So in the Chinese culture, the relatives usually wear white when mourning, and the funeral depends on the age and the status of the person that died. In the Japanese culture, they really think that acceptance of the death is important, and they also give condolence money. They also celebrate a holiday called Obon, which is a 3-day holiday in August where the spirits are supposed to return home to the ancestors and the graves are cleaned. In the Korean culture, they cremate ashes and refine them into colorful beads that are then kept in a bottle or an urn. In Ghana, they make elaborate coffins that are supposed to show the personality, like in the picture of the person that died, and they also have really elaborate funerals to really celebrate the person's life. In Madagascar, they have the turning of the bones, which is when every 7 years the ancestors dig up and clean the bones of the deceased out of respect. And then in Ecuador, relatives try to forget the deceased.
All right, so that concludes our presentation on end of life and grief. So now you guys can go ahead and fill out the questions on the Google form, and this Zoom link will be up on the top. So if you get stuck on a question, you can go ahead and click on that link and rewatch the video. Also, the PowerPoint will be attached as well because we have some notes at the bottom too with more information. Okay. Thank you.